Dr. Girish Malladad. I will be telling you something on disease known as GERD or gastroesophageal reflux disease. In routine language, you call it as acidity, and the medical term for it is gastroesophageal reflux disease or GERD. I will be telling you regarding this disease. The people will be having the symptoms of acidity such as burning sensation in the chest or the upper abdomen, and they come with a thing known as heartburn. It is nothing to be associated with heart, but since it has a burning sensation in chest, it is known as heartburn or acidity. And if this condition or the acidity or the heartburn persist, then it is known as gastroesophageal reflux disease in medical terms. The common symptoms of the GERD are the burning sensation in the chest, or the pain in the upper abdomen, or even some patients may be having a sore throat, sore taste in the tongue, or khatte dakar jo bolte hain Hindi mein. That thing will be having, the patients will be having, and because of this sometimes patient may be having vomiting, and very rarely the patient may present with complications, which I will be telling in the later period. The most alarming symptom is heartburn, that is burning sensation in the chest and sore taste in the tongue, and whatever food you have consumed in the yesterday or today, the taste of that food will be coming and touching your tongue, and the whole day that taste will be there, and the soreness in the tongue or the soreness in the throat will be there throughout the day. And this happens more on empty stomach. If you take food in the 9 o'clock in the morning till 12 o'clock, you will be alright. Around 12:30 in the noon, you will get a burning sensation and soreness in the mouth, and again if you take some food, that subsides. That's classical of acidity or the reflux symptom. I told you about the routine symptoms of the acidity or the GERD. Now I will tell you a little bit about the hidden symptoms of the GERD. So all the patients need not come with the acidity. Some patients who tolerate the acidity or tolerate heartburn for long duration, they may be having symptoms classically unrelated with GERD, or the so-called unconventional or the hidden symptoms. So such patients may come with symptoms suggestive of respiratory system, such as recurrent cough, or some patients may be being treated as asthma for long long period, may be having a hidden GERD there. And such patients have recurrent cough, and they are being treated for cough by the chest physician, and finally they end up with gastroenterologist with hidden GERD. So if you are getting a recurrent cough, and if you are getting a recurrent heartburn and GERD, you need to consult a gastroenterologist. This thing happens because both the tubes, that is food pipe and the respiratory pipe, both are together and both are besides each other. So whatever the acidic content that gets refluxed into the food pipe from the stomach can reach up to throat and your voice box or your respiratory tube, and that may lead to recurrent infection and cough. The routine available drugs on the normal stores are acid, they are not the acid suppression drugs, and those drugs are being taken regularly by most of them. They are just an acid neutralizer. So acid is the one which is secreted in the stomach for digestion purpose. When this acid increases in amount, that causes acidity. And whatever the routine drugs you are taking on the not so-called drug stores, they are just the acid neutralizers, and they are not the acid suppressors. So there are special medications for acidity and heartburn that you need to consult a gastroenterologist and take it. The people ask me whether it is possible for long relief from the GERD or the acidity, because what they say that they take drugs for 30 days or 2 months, and again when they stop it, the symptoms recur. That is classical of GERD, and some patients, not all, some patients need to take GERD drugs prescribed by the gastroenterologist for a longer duration. There are available drugs, there are available medications that can suppress the acid in the stomach and reduce the symptoms of GERD, but they are to be taken after consulting a gastroenterologist. Not the routine neutralizing drugs, they are not so helpful. Only the acid suppressing drugs prescribed by the physician are to be taken. So what causes these things is important. The main cause is stress and dietary habits of the person. Stress is the one which causes hyperacidity, so you need to be cool, do a physical exercise, do pranayama, dhyana, such things, and you need to have your meal very frequently. You should not take food. What you people do, you take a lot of food in the morning, go for work. After finishing work, again you come overnight, have a nice dinner, and you sleep out. That should not happen. You should take small, frequent meals, around 5 to 6 times a day, and try to avoid heavy masala foods and those foods having very high chilies, and those foods which are having oil content are to be avoided, and they are to be consumed in lesser quantity. And smoking is the one which causes acidity and heartburn, and even the alcohol has been proven to be a part of causative agent for GERD or the acidity. And even the local pan supari and areca nuts and tobacco can also cause the symptoms. So these are the causative agents, and the person will be predisposed to get this acidity. Some people will be predisposed, and these are all the additive factors. If you add these all the factors to a predisposed person, we will be having GERD, and goes on to get the complications of GERD also. And fasting also worsens the symptoms. So the patient will be presenting to me with what he says is he consumes a lot of food in the morning, goes to work, and he goes on postponing the lunch till around 6 in the evening, because the workload will be heavy. So he thinks that after finishing this work I will get food, after finishing this work I will get food. So he goes on fasting for 8 to 6 hours in a day, and finally when he goes for lunch, it is around 4 p.m. or 5 p.m. and he have a lot of food again, and he sleeps for some time. So fasting for longer duration also causes acidity or the GERD. So avoid fasting for long duration. Night you can't help, you need a good sleep, or you need not get up in the night and have food. But daytime you should have a small frequent meals. Don't go on postponing dinner or lunch, and try to avoid sleeping soon after having food. So better to have food around 3 to 4 hours before your sound sleep. So how you will know that you are having acidity? The main symptom will be heartburn, soreness in the throat, or the kate, dakar, or ulti jo bolte hain. So only patients will be, only complications will lead to vomiting. The early symptom is heartburn and the sore throat, soreness in the mouth, and the symptom is so much so that it will affect your daily life. Some people will be having mild acidity and mild soreness, but many people come to me only after that affects their daily life, because whatever work or whatever profession they are doing, they could not concentrate on that because of these symptoms. Only such symptoms are to be said to be alarming signs, and most of them they take the routine acid neutralizing counter available drugs, but they are of little help, and they come to physician at the end. Does this cause any complications? Yes, this has a complication percentage. Some people avoid consulting a doctor, and they go on consuming these acid neutralizing drugs, and they don't they do all the things which are not to be done, which I told just now, and finally they end up with the complications. What complications can occur if the skin of the food pipe is very smooth, and that is not exposed to acid. Only the skin in the stomach is exposed to acid, and that skin is made up so that it can tolerate acid. But the skin in the food pipe is not the one made for acid. So recurrent exposure to acid makes it a thicker skin, and it may turn into a skin of stomach and leading to complications. The most common complication that can occur is stricture. Stricture means the skin of the food pipe gets narrowed. The food pipe is round, and gradually it goes on decreasing in size, and narrowness of the food pipe can lead to the complications that can occur are the one leading to cancer of the food pipe, or known as cancer esophagus. That can occur after a prolonged period of around 20 to 30 years. If you are having GERD for a prolonged period of 30 to 40 years, you may get cancer of the esophagus, and that is the deadliest complication of the GERD. That won't occur in younger age. Only thing, the acidity or the GERD which occurs for prolonged period, the reflux of the acidic content in the food pipe makes it thicker skin of the esophagus, and that leads to stricture, and that leads to malignancy due to residual food that remains in the esophagus, or so on so. And these complications, how to get it? These complications are to be understood by the routine people and normal people, and they are the symptoms that come during such complications are you will get difficulty in swallowing, or even you may get a vomiting, recurrent vomiting. You consume food, and just after 10 to 20 minutes you will vomit everything. Recurrent vomiting or difficulty in swallowing, they are the alarming signs, and if such signs are there for prolonged period, more than 1 week or more than 2 weeks, you need to consult a gastroenterologist, and you need to undergo an endoscopy. But not all patients will be having only GERD. There are some diseases which are associated with GERD. There are other diseases related with bowel, or the liver, or even the pancreas. That can lead to even the hookworms or the worm infestation in the bowel. They are the certain examples which can also be associated with GERD, and can lead to reflux of the food items and reflux of acid. Some people ask me whether I can control myself without medications on non-medicating drugs. There are certain theories which tell you that you can do a healthy life, and that can lead to reducing the symptoms of GERD, and most of them can stop the medications gradually if they practice a good lifestyle modifications. And 50% of, say around 50% of them need for GERD drugs for a prolonged period, even they practice a good lifestyle modifications. The lifestyle modifications are the same which I told you, that you need to take small frequent meals, and you need to sleep 3 hours after taking food, and you need to stop smoking tobacco and alcohol, and coffee, tea are also said to be a causative agents. Wearing tight clothes are also said to be related with acidity, and even eating masala foods and soft drinks, and even the food containing chilies are also said to be a causative factor. There are medications available for these drugs, and many medications are there, and some of them are acid neutralizing, some are acid suppressing. In acid suppressing, again there are 2-3 varieties. So very good medications are available nowadays, and they are to be taken. To conclude, GERD is the disease which can be treated at the early part with simple medications, and if the condition worsens and leads to complications, the patient may need endoscopy there, and if the symptoms worsens further and if the patient does not take treatment, again it may lead to therapeutic endoscopy, such as some patients may need a dilatation, that is opening of the narrowed part, and some patients need a biopsy, that is suspected skin of the foot pipe is piece of that part is taken and sent for examination to look whether that is a normal skin of the foot pipe, or is it some complicated skin, or is it a cancer. And based on that, again you may need a regular Doogie dilatation, that is a long pipe will be passed through your mouth, and the narrowed part of the esophagus that is there, it is to be opened up, or it is to be dilated, and some patients may end up with a cancer esophagus, and such patients need surgery. And there is another treatment option of GERD. In patients having hiatus hernia, that is the foot pipe and the stomach, in between these two there will be a small door-like thing, and that door-like thing will be loose, and such a thing is known as hiatus hernia. And if there are 3 varieties, mild, moderate and severe, and in severe variety for prolonged period, if the patient is having reflux symptoms, you may end up with a gastro surgeon for surgery, and that too nowadays it's done under laparoscopy, and it is a permanent treatment option for GERD with hiatus hernia. Okay, thank you.
Start, sir.
I will be telling you some interesting cases during my practice. They are related with GERD. One old patient, around 60-year-old, he presented with vague chest pain, and that patient presented to me for endoscopy, and he was telling, after reading some internet videos and after reading some PDFs in internet, he came to know that chest pain is related to GERD, and so he presented to me. And the main symptom was sudden onset of chest pain since 3 hours, and he had sweating, and the chest pain was so severe that he was shouting with pain, and he wanted only endoscopy to be done. And that is not a routine or the usual symptoms of the GERD, and I took a ECG, and that led to myocardial infarction, that is heart attack. So that patient had a heart attack, and that symptom was nothing to do with GERD. Coming on to another patient, he was a young boy around going to PUC and SLC class student. He presented with chest pain. He was being evaluated for around 4 to 6 months for chest pain somewhere. He has undergone all the tests, and most of them had declined endoscopy because suspecting that such a young child should not have any acidity or the peptic diseases. So when I took the history, the boy revealed that he was consuming tobacco since he was in 7th standard. So that person was taking tobacco for almost 5 years. And when I did endoscopy, he had a big ulcer, that is a defect in the skin of the food pipe. Around 3 to 4 centimeter ulcer was there in the esophagus. And I took the biopsy. Biopsy is nothing but taking the small pieces of the skin of the food pipe and surrounding that ulcer or the defect in the skin of the food pipe. And fortunately, that didn't turn up into malignancy, and that was a benign or the non-cancer ulcer of the food pipe. And after putting him on newer medications for longer duration, that got suppressed, and repeat endoscopy showed normal skin of the food pipe. The boy has stopped tobacco now, and he is doing well. And another young lady, she presented with a vague symptom of drinking too much water while consuming food. The patient says that after eating for just 1 minute or 2 minutes, she consumes water, and that food gets stuck in the chest in between, and so whenever she drinks water, the food goes on. There was a classical symptom of some defect or some narrowness in the food pipe, and when I did the endoscopy, that lady had a stricture esophagus, or the narrowed food pipe of the food pipe, and she went on having medication for a prolonged period, and underwent a dilatation for 3-4 settings, and she is doing well now again. And one patient was being treated for asthma, and she was being treated for asthma for 3 to 4 years, and that patient had symptoms of GERD, and because the atypical or the unconventional symptoms were more than the typical symptoms, so the GERD was not looked into, and after suspecting causative agent to be acidity, I did an endoscopy, and she had a severe reflux esophagitis, or the inflammation or the injury to the food pipe of the esophagus was there, and that was almost sloughed off, and she sloughed off. There was a tear in the food pipe, skin of the food pipe, and there were many injuries to the food pipe, and that led to reflux of the acid into the larynx, and leading to repeated asthmatic attacks or the cough. And many patients come with hiccups. The only complaint is recurrent hiccup, and hiccup is one symptom that is also related with GERD. The most commonly, the hiccup patient will be having severe acidity or the severe burning sensation in the chest, and that lead to the injury to the parts in the chest, and that leads to hiccups. So hiccups is also a symptom of the acidity or the GERD. And some patients who presented to me with peptic symptoms or these routine symptoms of heartburn and acidity, after I did an endoscopy, there were small white patches in the esophagus or the food pipe. That is known as some very rare infection, that is candida infection in the food pipe. That candida infection in the food pipe is because of it is closely related with acidity and diabetes, and that patient will be having symptoms suggestive of GERD or the acidity, but on doing endoscopy, that turned out to be a candidiasis. And after putting her on a longer period of antifungal drugs, that patient she is doing well now. But diabetes diagnosed only after the candidiasis or the acidic symptoms led to her endoscopy. That led to candidiasis, and then she was diagnosed to be a diabetic patient. And some patient presented with acidic symptoms of severe variety, and again I did endoscopy. Again that patient also had this candidiasis or the white patches in the food pipe. That patient was suspected to be having retro illness, that is HIV infection, and that patient had a HIV infection, and that has led to candidiasis and acidic symptoms. So there is a collaboration, or the symptoms gets flown into this disease to that disease, and so the acidic symptoms are not the normal chalta hai bolke symptoms. You need to consult a good physician or a gastroenterologist and take treatment, because nowadays the drugs are there, and even the ulcers can be treated with those drugs. The patient need not undergo surgery directly. The good medications are available, and you need to consult a good physician or gastroenterologist and take help of them. Thank you.